Hello, I'm Danielle Boyce. Welcome to the first of a series of videos based on my blog post, How to Research Your Kid's Medical Condition Like a Pro. Of course, these videos will be useful to you even if you're not a parent, but if you want to look up information about an adult's condition or disease. ClinicalTrials.gov is the first site that I'm going to feature in this video series because one of the most common questions I receive from parents of newly diagnosed children is, how do I learn who is doing research in my child's disease or condition? You may have heard of a study that is enrolling at a specific hospital, or you may have heard of a specific drug that is being studied. This is the site where you can see all of the studies that are currently recruiting, those that are almost ready to recruit, and those that are completed. So let's get started. In this example, let's pretend we are a mother of a child newly diagnosed with infantile spasms. That is the condition that my son had. And you're interested in learning more about studies that are currently enrolling or about to enroll. Studies that your child might be eligible to participate in. So you click on recruiting and not yet recruiting studies. That's a little confusing for some people, but that just means that there's just a few formalities that they have to work out, maybe with their study sponsor, such as the drug company, maybe some equipment that they need to purchase, or internal approvals at their hospital that need to be cleared, and then they will enroll. So those are the up and coming studies. Recruiting means they're currently enrolling. Condition or disease, I'm going to put in infantile spasms. I'm going to give you some tips. Here, in other terms, you can put in the study doctor's name or the drug name, for example, or other keywords. But remember that whatever you put in here is going to narrow your search. So if you don't spell the study drug name properly, or if you use the brand name of the study drug and this study is actually on the generic name, you might miss some results. So for me, with a rare condition, and you'll see on the next page, it's always better to start broadly because you probably won't have that many results to sift through. So better to sift through a lot of results than only get two and not know what you're missing. With a condition like diabetes, then you might want to be more specific because you might be overwhelmed with the results. But even in that case, I'll show you on the next page, you can still narrow down and filter out your broad results through that page. So my personal philosophy is always go more broad. In terms of the study doctor name, keep in mind that ClinicalTrials.gov only features the main senior study doctor name or the individual site study doctor names. So if you went to your physician who might be a junior physician and he tells you we're enrolling for a study on infantile spasms and you put in his name, the study might not come up because ClinicalTrials.gov might only have his boss's name, the senior study doctor. So just keep that in mind when you try to narrow it down. Sometimes better to go more broad. Country will show you all of the countries that are enrolling for the study. In this case, for geography, I never go more specific than United States. And here's why. Because as I'll show you on the next page, even though a study might have officially just 2 sites, that doesn't mean they would not potentially pay for travel expenses for you to come to their site, or they wouldn't consider a colleague in your area being added to the study protocol so that you could enroll locally at your site, especially for a very rare and severe condition like this. It's a very small research community, And physicians know each other, and they go to conferences together and work on projects together collaboratively. So don't limit yourself by your own geographic region. You can always ask, and I'll show you how to do that next. Okay, so we said we want recruiting and not yet recruiting studies. We want infantile spasms, United States, and we just left it at that. Let's see what we find. So we have 4 studies for recruiting, not yet recruiting infantile spasms in the United States. And this one is new. And this will show you the status, recruiting or not yet recruiting, the study title, which tells you a lot, the condition, the intervention, which is just the treatment, the drug, what is going to happen to you if you're enrolled in this study, and the locations. Okay, so it's interesting here to note too, just how I was talking about the different search terms. This study, when they submitted their ClinicalTrials.gov application, they listed infantile spasms as their condition, the primary disease. Whereas this study listed refractory infantile spasms. Even though this first study that only listed infantile spasms is actually for refractory infantile spasms. So you can see how you need to experiment with the terms, and sometimes it's better to be more broad and pick up more terms. But always pay attention to that. Okay, so let's say we want to, I'm not going to do this here because it probably won't show up because there's only 4 studies listed here and they're all pediatric. But let's say you had a huge list of results. You just put in epilepsy, which infantile spasms is under the umbrella of epilepsy. And you wanted to know if your child age 10 is eligible for any of these studies. That's a good way to narrow it down. Let's say they're only interested in males and you're interested in that. Accepts healthy volunteers. Those would be a control group, potentially. Study type, you can find out. Study results. So if you heard there was a phase 3 study, you could click on that and it would break it down. The type, a funder type, that's just who's paying for the study or helping to pay for the study. So industry would be a pharmaceutical company usually. And study documents, which studies list their study protocols and provide consent forms and statistical analysis plans with their ClinicalTrials.gov registration. Okay, you can also download your search results here. See where it says download? And it will, when you download, it will display it as any file format you want, but a PDF, plain text, tab, comma, or XML. And then you can look at it later or send it to your doctor, post it in your support group. Okay, so let's click on this first one. It is a treatment of refractory infantile spasms with fenfluramine. Infantile spasms is a condition. The intervention is the drug. And here are your locations. So we click on this and you get all this good information that the study provided. So the sponsor is UCLA, and this is who provided the information, who's usually the study doctor, and that's Dr. Hussein, who we love in the infantile spasms community. And this is just different ways to view it, the study results or the tabular view, just different ways to view this information. And then this says no results posted. That means if a study has concluded and they report back to ClinicalTrials.gov how many people were enrolled, how many dropped out, were there any adverse events, like did something unexpected happen during the course of the study, and any studies that were written up and published in peer-reviewed journal articles could be linked here, and it would be a way for you to find out more about what they discovered in their study. And in a separate video, I'm going to show you how to use PubMed to learn more about research studies that have been published. So you can see here, this is at phase 2, it's infantile spasms, and you can click on these and it'll tell you a glossary of, everywhere it has a little I for information, a glossary of what any of these terms mean. Don't be intimidated by this. This is meant to be for you. This isn't just for doctors. This is for you to learn and to be able to take control of your child's future and participation in research. This is published because the scientific community wants you to find out about it, and they want you to reach out. So please do not ever feel intimidated to reach out and talk to the study teams. In a rare disease like infantile spasms, sometimes there's a struggle to enroll patients who meet the eligibility criteria, which I'm going to talk to you about in a second, right here. And so they're looking for any lead that they can get on eligible patients, and that might mean that they fly you in, as I mentioned before, to participate in the study. So I'm not saying this study would do that, but some would. So don't be intimidated if it doesn't look like you're a perfect match for this one. Feel free to reach out, and they're usually very friendly and often list a coordinator's name, so you're not even, quote, bothering the study doctor. You're actually contacting someone who gets paid to take calls and emails from you. All right, so this is really important for you to look at. These are the inclusion and exclusion criteria. So your inclusion criteria mean who is eligible to participate in this study. So if your child is age 3 to 36 months inclusive, has the clinical diagnosis of infantile spasms, and still has spasms even though you tried ACTH and vigabatrin, then you've made it this far, you're eligible so far. But then you also have to look at the exclusion criteria. The exclusion criteria mean characteristics of your child that would make them not a good match for this study. And sometimes this is based on the potential side effects of the drug they might want to try. They wouldn't want to put a child at risk who has these other underlying conditions. But also sometimes this is because they want a study population that is very similar to one another and doesn't have underlying causes or other medications that they're taking that could make it confusing to interpret the results. And this is especially true in a study that is enrolling so few patients like this one. It looks like it's only enrolling 10. Okay, so the exclusion criteria are significant pre-existing cardiovascular disease, exposure to any cannabinoid product within 14 days of screening, and you can here read the rest. So here's your contacts and locations. Again, if you want to participate in this, always worth reaching out, asking them to put you on a list if they have a e-newsletter of their research. Always good to reach out and make yourself known to the study sites. And here is your study coordinator. And there's more information here. And I will show you how to use mesh terms in another video. So that's it. That's all there is to it. That's ClinicalTrials.gov. If you have any questions about this, feel free to reach out to me. Comment on my Twitter feed. I will strive to make better and better quality videos as the year goes on. Thank you very much for listening. Bye.